We've made this climb together, facing the unknowns of 2024, navigating the terrain in 2025. A journey that proved our strength and resilience. And now in 2026, we take in the view from the top, a place of clarity and new horizons.
Welcome to our 2026 product launch. As we look ahead, it's important to recognize the reality shaping healthcare today and why gap cover has become more essential than ever. Rising healthcare costs continue to put real pressure on our clients, and that's why we want to share the context of these trends and healthcare experiences and how they guide the solutions we bring you. Between 2019 and 2025, hospital admissions across all medical aids rose sharply. They dipped during COVID-19, but today they are higher than before the pandemic. Medical cases are more complex, and hospitals treat more severe conditions and admit more patients than before, which drives up costs. Middle and high-end medical aid plan admissions have declined, while admission on low-end plans have climbed significantly. This reflects on the growing number of members on these plans and financial pressures that can delay care until hospitalization becomes necessary. In the last financial year, medical aid claim costs increased by 12 to 13% per member per month. Hospital claims, primarily driven by specialist fees, rose over 17%. Specialists remain a significant cost driver. Pathology and radiology costs rose 18% last year, while orthopedic surgeons, general surgeons, and physicians saw double-digit increases. Co-payments, high-cost procedures, and rising specialist tariffs continue to increase claims yearly. At the same time, medical schemes expand hospital and provider networks. But when members use providers outside these networks, co-payments fall back onto gap cover. This dynamic shows that while gap cover works alongside medical aid, our benefit structures must evolve to influence member behavior. In 2024, medical aid contributions rose 3 to 4% above inflation, leaving many plans unaffordable. Members are buying down into cheaper, lower cover medical aid options, which come with trade-offs. Higher co-payments, reduced benefits, and less protection when specialist bills arrive. And with many specialists charging up to 5 times the medical aid rate, those shortfalls are larger and more frequent. Gap cover claims highlight the scale of shortfalls today. Larger claims are now more common. Hospital inflation, high-cost procedures, and rising co-payments continue to drive the demand for gap cover. This is a financial safety net, ensuring clients can access quality private healthcare without devastating costs. In the first quarter of 2025 alone, Stratum benefits paid hundreds of claims, with the average shortfall ranging from 54,000 to 126,000. Some claims exceeding 200,000, with the largest in excess of 205,000. 155 claims, averaging shortfalls of 54,000 Rand, totaling 8.4 million. 112 claims, averaging shortfalls of 65,000 Rand, totaling 7.3 million. 76 claims, averaging shortfalls of 74,000 Rand, totaling 5.7 million. 45 claims, averaging shortfalls of 85,000 Rand, totaling 3.9 million. 27 claims, averaging shortfalls of 95,000 Rand, totaling 2.5 million. 73 claims, averaging shortfalls of 126,000 Rand, totaling 9.2 million. Now, let's explore the specifics of our products and what they mean for you.
Our 2026 individual gap cover product range is made up of Compact 300, Meridian 400, Elite 500, Access Optimizer, and Access Copay Plus 300. Our corporate range consists of Corporate Compact 300, Corporate Meridian 400, Corporate Nova 500, Corporate Elite 500, Corporate Access Copay Plus 300, and Corporate Access Plus 500. The overall policy limit on all gap cover options increased to 219,845 Rand per person per year, effective the 1st of April 2025. Our benefit enhancements are as follows. On Compact 300 and Corporate Compact 300, the penalty co-payment benefit increases from 10,000 Rand to 12,000 Rand per policy per year. Under the casualty benefit, external medical items received at the medical facility due to an accident are limited to 1,000 Rand per policy per year. Follow-up visits for accident-related casualty events are limited to 1 per person per event, subject to the benefit limit of 6,000 Rand per policy per year. The sub-limit benefit for MRI, CT and PET scans increases from 3,500 Rand to 4,000 Rand per person per event. On Meridian 400 and Corporate Meridian 400, the penalty co-payment benefit increases from 9,000 Rand to 10,500 Rand, limited to 1 co-payment per policy per year. These options receive 2 new benefits. The cancer treatment top-up benefit covers ongoing cancer treatment when the medical aid plan's benefit limit has been reached, with a limit of 50,000 Rand per person per year. The preventative care benefit covers shortfalls or the total cost of consultation fees and a list of preventative immunizations, procedures, scans, screenings, tests, and vaccinations. This is limited to 2 events up to 500 Rand per event per policy per year. Under the casualty benefit, external medical items received at the medical facility due to an accident are limited to 2 events up to 1,000 Rand per person per event, subject to the benefit limit of 9,500 Rand per person per event. On Elite 500 and Corporate Elite 500, the penalty co-payment benefit increases from 15,000 Rand to 16,000 Rand per co-payment, limited to 2 co-payments per policy per year. The sub-limit benefit for colonoscopies, enteroscopies, and gastroscopies increases from 6,500 Rand to 7,000 Rand per person per event. The sub-limit benefit for MRI, CT, and PET scans increases from 5,000 Rand to 6,000 Rand per person per event. The top-up benefit for MRI, CT, and PET scans increases from 5,000 Rand to 6,000 Rand per policy per year. Under the casualty benefit, external medical items received at the medical facility due to an accident are limited to 2,000 Rand per policy per year. Follow-up visits for accident-related casualty events are limited to 1 per person per event, subject to the benefit limit of 15,000 Rand per policy per year. The preventative care benefit increases from 1,800 Rand to 2,000 Rand per policy per year. On Access Copay Plus 300 and Corporate Access Copay Plus 300. The admission and procedure co-payment benefit increases from 6,500 Rand to 7,000 Rand per policy per year. The following options all receive a new benefit. The sub-limit benefit for out-of-hospital MRI and CT scans. This benefit covers the difference in cost for out-of-hospital scans when the medical aid pays an amount from a sub-limit or annual limit but doesn't cover the total cost. This is limited to 2,000 Rand per policy per year. The casualty benefit for these options increases from 3,000 Rand to 4,000 Rand per policy per year. For the following options, the per policy per year limit under the casualty benefit increases as follows. Edge 200 from 3,500 Rand to 4,500 Rand. Compact 200 and Corporate Compact 200 from 6,000 Rand to 7,000 Rand. Base 500 and GeForce 500 from 7,000 Rand to 8,000 Rand. Co-Evolution 500 from 8,000 Rand to 9,000 Rand. Senior 500 from 4,000 Rand to 5,000 Rand. Access Optimizer Plus 200 and Access Optimizer Plus 500 from 2,000 Rand to 3,000 Rand. On all options, the after-hours window for illness-related casualty events starts at 7 p.m., not 6 p.m., and still ends at 7 a.m. The journey ahead is about more than just navigating changes. It's about supporting the people we serve in every way possible. One of the most urgent is in mental health, where the need for meaningful support has never been greater.
Mental health was the fastest growing hospital admission category in 2024 and 2025, with admissions rising by 30 to 40%. While gap cover does not cover these admissions, we recognize the need for meaningful support. That's why we've introduced the Wellness Care Line at no cost to our clients. In partnership with the Reality Wellness Group, this service offers expert support for anyone facing mental health challenges such as stress, anxiety, or depression. All gap cover policyholders and their dependents will have access to complimentary telephone and virtual counseling sessions, available 24/7, ensuring support is always within reach.
Our gap cover premiums will increase as follows. Your digital launch pack is now available for download, complete with phase-required product-specific training assessments. The details can be found in our launch email. Your dedicated broker consultant will assist with training and any questions you may have.
We encourage our clients to make informed decisions, negotiate costs for planned procedures, request quotes, and use cover wisely. In a healthcare system where medical schemes cover less, providers charge more, and consumers are caught in the middle, gap cover is essential for financial survival. Gap cover in 2026 and beyond will be more than insurance. It will be peace of mind and protection when it matters most. We've been on an incredible journey together. Thank you for your unwavering support and for helping us make a tangible difference in people's lives. We're excited to continue our partnership. Next up, our health insurance product range. If you have members on these plans, please continue watching for a look at the benefit enhancements and premiums.
The individual and corporate health insurance product ranges consist of the Essential Primary Plus and Corporate Essential Day-to-Day benefit options, the Essential Primary Plus and Corporate Essential Emergency and Accident benefit options. Please note, the hospital cash plan was closed for new business as of the 4th of September 2025 and will be discontinued for existing members effective the 1st of January 2026. Unity Health will guide members through a structured transition process, which will be communicated when implemented. Benefit enhancements and limits on the day-to-day benefit options include out-of-network GP consultations increases from 330 Rand to 345 Rand per consultation, limited to 2 consultations per person. Specialist consultations increases from 1,600 Rand to 1,675 Rand per consultation. The overall family limit increases from 3,350 Rand to 3,500 Rand per family. Pre-birth consultations still offer 3 gynae visits and 3 2D ultrasound scans per year. The overall family limit increases from 4,000 Rand to 4,175 Rand per family. The dental care benefit increases as follows. For a single member, from 1,500 Rand to 1,550 Rand. A member plus one, from 3,000 Rand to 3,100 Rand per family. And a member plus two, from 4,500 Rand to 4,650 Rand per family. This is subject to 1,550 Rand per person. Benefit enhancements and limits on the emergency and accident benefit options are as follows. Emergency cover increases from 100,000 Rand to 105,000 Rand per person per event. Accident cover increases from 1,600,000 Rand to 1,675,000 Rand per person per event. Casualty accident cover increases from 8,000 Rand to 8,350 Rand per person per event. MRI and CT scans increases from 21,000 Rand to 22,000 Rand per person per year. Physio and occupational therapy increases from 4,000 Rand to 4,175 Rand per person per year. The accidental death payout benefit for a principal insured and spouse increases from 35,000 Rand to 40,000 Rand per person. The child benefit of 10,000 Rand remains unchanged. The accidental disability payout benefit increases from 35,000 Rand to 40,000 Rand. This payout is in the event of total and permanent disability of the principal insured due to an accident. We've introduced a new payout benefit in 2026, the Family Assistance Benefit. If an insured person is hospitalized for more than 2 days, a nominated family member or friend receives a cash benefit of up to 1,500 Rand per day, with a maximum of 4,500 Rand per admission. This benefit applies to travel distances of 20 kilometers or more and can be used towards reasonable travel and accommodation expenses. It is payable from the first day of an authorized hospital admission. The health insurance premiums will increase as follows. This concludes our 2026 launch. Thank you again for your support. As a reminder, your digital launch pack is now available for download, and your dedicated broker consultant is available to assist with any questions you may have.